be the change that you want to see in the rest of the world. When you go out there and you start treating, if you love treating and you're a clinician and you realize that you're getting burned out and it's not fun anymore, don't just leave the industry, find a better spot or create your own.
All right, last guest. Are you ready to power through? You're the cleanup hitter. Our next guest, reshaping the future of healthcare. She's a physical therapist, clinical innovator, and one of the leading voices in the industry in how tech and AI are transforming patient care. She's helping clinicians beat burnout, Matt talked about, while building smarter, more sustainable practices. Please welcome Dr. Marla Ranieri. Did I say that right?
You did.
Nailed it. Let's hear it from Marla. You have a last guest. You've said before that PT students hear a lot of outdated advice. What's the truth they actually need to hear in 2026? What is some of the things that you're like, if I could scrub that from your brain, what would you just, control, delete?
Yeah, so when you guys are out going into your clinical affiliations, a lot of times you just see people writing notes after hours. You see the way the structure is done. There's a lot of extra work and admin work that you're doing. And you went into PT to treat. You went in to care for patients. So a lot of that extra stuff kind of sucks. And I just want to let you know that doesn't have to be that way. It does not have to be that way.
So you work for a technology company.
I do.
And you just briefly, what's your role there? Like, what do you get? I don't care about the title. The title's cool, but what do you get to do?
Yeah, so I'm the head of clinical innovation and strategy, which means I help bring in some of the top industry leaders and ask them, what do we need in PT? What are our pain points? What do we need to fix? And then we build technology to do that. And honestly, one of the big pain points has been burnout, has been 40% of clinicians leaving the field because they love what they're doing. They love treating patients, but they hate all the extra parts and going home after hours doing notes and on the weekends and all the admin work. And so we're really trying to fix that and combat that.
Yeah, so it wouldn't seem like an obvious, you're not going to get this on like a message board, like questions you should ask during an interview. And by the way, an interview is a two-way interview. You do not win interviews. Your job is not to get the role of the interview is not to win the job. You should be asking as many, if not more, questions. I don't know if I ever asked what EMR do you use, but is there a piece of technology or equipment that you are using more as a clinician than the EMR? I feel like that is a valid question.
Yeah, and I would say for all of you, has anyone used AI in your real life right now? Personal life, school life?
Has anyone not used AI? That would be a great, okay, good.
Okay.
Really? Not at all? Oh, we all want to talk. Yeah, I want to see what that's like. You've got like native brain. I appreciate that. Yeah, what's that like?
Well, I would definitely recommend that you should be using AI to help learn, to help educate yourself, to use it as a mentor. I mean, we heard about some of the business people out here who said it helped them grow. Yeah. And so you should also be asking about that when you go out to your first jobs. What kind of technology and tools do you have to assist me as a clinician and make me a better clinician? And do you have to make sure that I am not burning out and I'm still loving my job? So I do think you should ask, what's the EMR, what's the technology, what AI pieces, what alternative business models, alternative compensation models are you looking at? Because, by the way that PTs get paid, we do need to change. Advocacy is helping us tremendously at the APTA, but you guys need to advocate for yourselves as well. And there are a lot of alternative models we should be going out and doing and starting to participate in value-based care. And that's not going to change at these business corporate levels unless you guys coming out as students. By the way, everybody wants you.
Yeah.
You are the most needed person right now. We need PTs to grow. It's you guys that are going to change that. You got to be asking for that. You need to be saying, hey, tell me what technology you're using. What are you looking at for alternative compensation models? How are you looking to change and innovate? And that's what's really going to move the needle at those companies.
Use AI to learn things clinically, help you write your note. I'm using it currently to figure out how to use an air fryer because I keep burning French fries. But we're going to get there slowly but surely. Here's a devious interview question, either on the way of the clinic asking someone they're looking to hire, or you can flip it. If I were to leave 3 years from now, what do you think the reason might be?
Ooh,
that makes someone think and not answer. So someone's going to show their cards to you. If you ask that to a new grad, if you were going to leave in 3 years, what do you think the reason might be? If she's like, well, price, salary, you're like, okay, I understand what I need to make important now. If you're like, well, I just don't know am I going to be able to grow here? You're like, got it, leadership tracks. I call it a ricochet question, because if you said, what's most important to you, you're going to answer, it's going to be a holstered answer that you've thought about. I like to bounce questions off the wall, because I want you to actually think about the answer. You can flip that. You can say that to a clinic owner. If someone were to leave in 3 years, what do you think the main reason would be? They're going to show you what they don't have. And if that's a deal breaker, break the deal. If it's lack of technology, well, people are really frustrated because we're on, my last job, I was on paper notes. That was super fun. You're deep in tech and innovation, but you have a clinical mind, which is awesome. If you didn't have that clinical mind, we would just have a tech person making tech decisions, and then these people will be frustrated. But what are the biggest changes students will see that are coming in the next 3-5 years on the job? What are those biggest? What's the? Could be scary, it could be good. What's coming?
Well, I would say some of the things that are already out, which is really super cool, is we're doing AI intake, where as the patient is filling out the intake, it's actually asking alternative questions that's really based on what they're answering. And then all of that information gets inputted into the note, which is also really cool. So by the time it gets to me,
it's useful information and not stuff you filled out.
Right, it actually writes the subjective, the assessment, and the goals. And then while you're doing your eval, you could just click a button and it listens to you, ambient listening, and then it actually, again, writes your note for you, more in that objective, inserting the measurements and all that. You do have to be a little clearer with your patient, explaining what you're doing.
I tell people all the time,
you should be
the only change really has become more of, I guess, a verbal processor.
Yeah.
Is like, hey, saying it out loud. But Marla, this sounds a little bit like what Matt was saying. Like, it sounds like you're able to make eye contact with a human. That's weird.
And that's the goal.
Are we going to be okay with? Yeah, I know. Wouldn't that be weird?
We have to get back to that. Actually, when you did do paper notes, you were able to do that. Now, sometimes you've gotten away with that, but away from that. So we want to get back to that. We want you to have that human interaction. We want you to be able to treat the way you want to treat, have the best outcomes. And just to go back to a couple other AI pieces, we also just built what's called AI prediction no-show and AI prediction drop-off. It's starting to look and predict who may be dropping off or no-showing, and how can you prevention, get to that person earlier and make sure it doesn't happen. So there's a lot of ways technology can be augmentative and assistive, and I just encourage you guys to, as the future of the PT, to be seeking that out, to be using it, utilizing it, and to be asking for it. And if you get to a clinic that doesn't have it, I recommend finding ones that do, but if you don't, be the change and make them adopt some of these better pieces.
If I were writing copy for prompt, I might have like really soft like harp music, and I would say and just have the clinician here and the camera from the side, and just like you're telling me it's like bringing back eye contact, one patient interaction at a time, because that's what we want, right? You want to connect with these people, because the only way to actually help them change, it's got to be a connection first. Right?
Absolutely.
Wouldn't that be great? Just want a nickel if you guys take on that ad campaign that I just suggested. What are the signs that a clinic is actually innovative and not just saying, like 2 years ago, innovation was the word. Now it's AI, right? But 2-3 years ago, innovation was like, we're innovative. And I push back and I say, is the innovation in the room? Is it here? Can you show me? And then when they can't, so how do you spot that if someone's actually innovative and weed that organization out? Because you have power to make decisions. You don't have to take whatever. You can take what you want. So how do you actually spot that?
One way is to ask them, how do you grade or bonus your clinicians? And if they say, by visits, okay, not innovative. They should be saying by outcomes, by the way that they are bringing in revenue. Because believe it or not, you can be a pelvic health therapist and see somebody one-on-one and give extremely quality care. You're actually making more revenue than if you're seeing 4 patients in that hour. So it's really about the outcomes and the revenue and what you are bringing to the clinic. So I think that's a really great question to ask to see if they're innovative. That's going to set them up for things like value-based care, for population health, and you really want to see clinics that are pushing that way. And then, of course, asking, how do you expect people to do their notes? Is it done in the clinic or is it done at home?
I like loaded questions. Do I have to do my work during working hours or during non-working hours?
And if they say, we give, you could do it during your lunch, but, obviously you can get as much done during your day and then the rest has to go home with you, that is not innovative. You really have enough technology tools that you should get your notes done while you're seeing that patient. It should get done pretty much for you. And so I think that's an innovative. And then asking them just what technology tools do they have to support and assist your professional growth. So really important. So great questions to ask on interviews, and great questions to say, hey, if you don't have it, I'll be the person to help you find it.
Love that. Yeah. You said students, since we got an audience of great students in front of us, are shaping the future of the profession, not just entering the profession. What does that look like in real terms to you? Like, what does that look like? Because they've been told this, but like you haven't been out there.
Yeah. Obviously, definitely be advocating and in the APTA, that's absolutely what it looks like. But it also looks like what you are going out and doing when you ask for a job and when you go into the field. Because right now, everybody wants students, everybody wants clinicians. There is a crisis in terms of there's not enough PTs out there to fill the demand. So you're shaping the profession. When you start that job, that's actually when you have the most value, is before you start, because they want you so much. And I think, who was our one before? He had such a great point. They said, what differentiates you? So really, it's right there is how you can say what's going to differentiate you. Have a passion, know what you want, get out there and go for it. And that's really what's shaping it. If you guys are all pushing for that, then the corporations have to listen, because then they can't hire anyone if everyone's asking for that, right? So that's how you can be change agents, for sure.
You've had 7 orthopedic surgeries and your sister had 13. So are you still paying those off as a physical therapist since you were a kid? Like, what happened? What's going on?
Yeah.
Were you in demolition derby? What were you doing?
I was a very, very, very serious gymnast at the highest level, and collegiate and all of the above. So we had a lot of surgeries, a lot of injuries, but of course it brought me to this amazing profession. Yeah, I still pay for it, but I'm very athletic still. And
I meant the bill, like, because that many surgeries, your parents are probably like, yes, get out there and earn, please.
Yes, exactly.
Was your sister a gymnast too?
She was as well.
Overachiever because she had 13 surgeries and you only had 7?
Yeah, seriously.
Okay, got it. But was that your origin story? Because if you ask, most of the students in this room, everybody's got their own. Was that your origin story to the profession?
Actually, really quite interesting story about that is that I actually got into medical school, and I was about to go to medical school, and my physician, who I was so close with because I had
you bought him a
so
house.
many surgeries, and in college I had a ton, and so he literally looked at me and said, Marla, I know you so well. We have this amazing relationship. You should go to physical therapy. You're not going to find that in this medical field.
You're not going to find what you are looking for.
As an orthopedic surgeon, you love the relationship we have. I don't have this with any of my patients. And his wife was a physical therapist, and he actually said that your personality and how you care so much about patients and people, he guided me that way.
That's cool.
So I actually delayed my entrance into Columbia Medical, and I asked if I can go to PT, and they nicely accepted me.
That's pretty cool. Yeah. All right. What's one outdated norm in healthcare that needs to die like yesterday?
Outdated norm. The model you see that exists right now, don't take that as that has to be the model. It absolutely can change. Fee for service, it doesn't have to be that way. So don't just accept that.
So explain fee for service though, just on basic terms. Like how did you.
Fee for service means every visit that you see that patient, they pay you for it. They're just paying you for your service. We are so much more than that. We are MSK primary care providers. We are the specialists in movement, and we should be looked at and paid for how we treat and how we diagnose and how we look at musculoskeletal movement, right? So in that way, we should be paid for our value, not every little visit we give.
Well, otherwise, people who take the longest to help someone get better actually are rewarded for that. Like, you're rewarded for being pretty terrible, which seems like a bad scorecard.
Exactly. You're rewarded for seeing the patients for 25 visits when you could have gotten them better in 7, right? And actually, that's an interesting take. Sometimes some clinics do look at length of stay and kind of say, oh, you need to increase your length of stay. No, you want to see that patient, get them better, share with the PTA, let the PTA do some of the work as well. And actually, if you get them better faster, quicker, you will make more money in the sense of that you will be rewarded more money for your value, because it's like turning tables over. You'll see another case and you're able to help more people. So use RTM, remote therapeutic monitoring. Use the team, the PTAs and the PTs, and don't just accept the model that exists. Keep pushing for that more of that value model, and do enroll in these new CMS programs that are coming out. Educate yourself on them. A lot is coming out with this administration, and PT is going to change, and you guys could be that change that assists it.
Let's talk about Prompt. This is where you work, right? It's a technology company that's really focused not on healthcare. Like, you guys are actually niched within a niche, which I feel like gives you an advantage because you're so focused on rehab, I guess, would probably be a better area to put the scope. Why does that give you guys such an edge?
Because we are so invested in the industry and what's going on and changing to adapt to that industry, like we will be ready for when this value-based care comes out with the technology way. We are integrating with hospital systems to share data back and forth for outcomes. We're thinking ahead and really specializing in the PT-OT speech space so that we can build the technology needed to help this change occur.
Love that. Last thing we do each episode is the parting shot. It's our last parting shot. All right, Marla, what do you got for us?
Parting shot is be the change that you want to see in the rest of the world. When you go out there and you start treating, if you love treating and you're a clinician and you realize that you're getting burned out and it's not fun anymore, don't just leave the industry. Find a better spot or create your own.
Yeah, some of our guests have done that. Marla, thanks for your time. Let's hear it from Marla Ranieri.